Hello, everyone. Last year at COP26, about 50 countries committed to develop climate resilient and low carbon health systems. It's a significant commitment and shows the increasing awareness of governments to the impact of climate change on people's health. In recent years, several organizations have also committed to cutting down their own carbon emissions. But how are they doing it? How can partnerships play a role to help build climate resilient, low carbon health systems? And what role does innovation and technology play in this transition? Today, I'm pleased to be joined by three leaders who have been really engaged in driving the conversation, putting together the evidence on how this is being done, and helping implement resilience and decarbonization strategies within the sector or within their own institutions. We have with us Ms. Joy Phumaphi, Interim co-CEO and board member of the Clinton Health Access Initiative, Gary Cohen, President and founder of Healthcare Without Harm, and Joe Belliveau, Executive Director of MSF Canada. Welcome, everyone, and thank you for joining us today. Just before we start, I want to let our audience know that we have a live illustrator working in the background to capture important moments during the discussion, and we'll be showing you the final sketch at the end of this panel. So I'm going to start with Joy and ask if you can help set the stage here as to why the health sector really needs to accelerate work on becoming climate smart.
Well, thank you so much. This is a very important question. I think what we need to appreciate is that life on our planet is all about partnerships and balance. You know, Professor Haynes of the London School of Hygiene and Tropical Medicine and Howard Frumkin explained this relationship well in their book, Planetary Health, Safeguarding Human Health and Environment, on the Anthropone, which is, the age in which we live now, when human beings are doing, damage unintentionally in their interaction with the planet. What they say is that there are boundaries of climate and biosphere integrity that guarantee a safe operating environment within which humanity can flourish. But unfortunately, in our rush to accelerate what we call progress and development, we've created and are continuing to compound an imbalance by increasing CO2 levels, leading to rising temperatures, extreme weather, rising sea levels, fueling both indoor and outdoor pollution, respiratory tract infections, including childhood pneumonia, which kills close to 1 million children every year. We are fueling changes in vector ecology, such as the 30-fold increase in dengue over the past 50 years, or the increased distribution of schistosomiasis to an additional 20.7 million people in China. I mean, these are just examples. There's water and food supply impacts, water quality, environmental degradation, increased allergens, disruption of nitrogen and phosphorus cycles, that is an impact on our ability to grow food. The list goes on and on. What we are all looking at the moment as we talk about climate change and its impact on health and on our economies is the boundary of the 2 degrees Celsius as a tipping point. But unfortunately, the tipping points have actually been growing. The actual tipping points are not just the 2 degrees Celsius, but it is the glaciers that are melting. It is the deforestation. And these things are pushing us nearer and nearer to what we thought could potentially result in the negative impact and catastrophic consequences, particularly on global health, that we don't want to get to. Now, every sector must act now, and health is a pivotal partner in both mitigating the impact and, of course, adaptation strategies. So that is our challenge.
Thank you so much, Joy, for setting that scene. And you just pointed out every sector must act now. I wanted to go to Joe because, organizations are, waking up and really increasing because of the increased awareness of the impact of climate change and health. And I want to go to Joe because MSF is such a huge international medical humanitarian organization that has pledged to cut its own carbon emissions by at least 50% by 2030 compared to 2019 levels. Joe, can you tell us what led MSF to take this decision, and how are you building that movement within the organization to realize a really climate smart organization?
Thank you, Jenny. So, two main drivers, let's say, as a emergency oriented humanitarian organization, there's two main drivers that are pushing us towards being climate smart. The first is simply the current realities, the recognition that increasingly climate and environmental factors are contributing to humanitarian need. So, recurring droughts and floods in Somalia, for example, asthma and dengue in Haiti, extreme weather events in Madagascar, kidney failure in Central America, and so on and so on. So we just simply can't ignore the fact that climate and environment are increasingly factors of humanitarian need. And if we look to the future, it only looks set to get more and to get worse. So we need to be awake to that reality and adapting, as Joy said. We also need to recognize that the way the pattern of how this is happening is very unequal, inequitable. In other words, the impact of the climate crisis is much more on contexts where MSF typically responds already, where there are low resources and where humanitarian needs are already great. So we need to understand how that's working so that we can also use our voice more to advocate for change. The second main driver is simply organizational responsibility. So emergency-oriented organization, nevertheless, we have to the science is so clear now that we have to recognize that we also need to mitigate our environmental footprint as a global actor, flying all over the place, using diesel fuel everywhere. We can change, and we have a responsibility to change and mitigate. So the second part of your question was about the how. So it starts indeed with commitment, and you mentioned. So it actually in November 2020, Médecins Sans Frontières globally and unanimously agreed to an environmental pact within which there are a number of commitments. And I'll just briefly touch on two of those: mitigation and adaptation, as Joy was pointing out. So in mitigation, you mentioned, Jenny, indeed, that just 2 months ago, in fact, Médecins Sans Frontières globally and again unanimously voted to reduce its carbon emissions by 50% by 2030 based on 2019 baseline data. So, what does that look like? We know about the flights and the fuel use and so on. You've mentioned technology, and this gathering is partly about technology. So I'll just mention a couple of things. We've got a very exciting program using solar energy to produce oxygen. So we know, I'm sure by now everybody with COVID understands that oxygen shortages are a major issue. We're now able to produce oxygen using solar power instead of trucking fuel and then using fuel generators to produce oxygen on site. That's one very exciting use of technology. Telemedicine is another one. We've had a telemedicine program for years, but we see great promise in scaling up and expanding telemedicine, not to replace how the organization operates, but really to complement and reduce flights and reduce the need for in and out in some of these contexts. I could talk about waste management. I think Gary's going to speak to that too, but there's a lot in the waste management to unpack too. And then just very briefly on the adaptation side of things, I could talk a lot about how our operations need to change, how we need to wake up to some of the realities that I mentioned before. And one of the ways is anticipation. So I'll just speak briefly to that. So recognizing that these patterns of floods and droughts and extreme weather events, the better that we can anticipate those, the better that we can mount humanitarian responses. So in Haiti, for example, we've got a really exciting thing going on where we're working with local authorities to set up a weather station and at the same time an air quality sensor. So we're essentially able to bridge the gap between weather and climate related information and key climate sensitive diseases. Joy mentioned some of those: dengue, Zika, malaria, asthma, and so on. And so by measuring the particles that are in the air and shifts in weather patterns, we're in a better position to actually be able to anticipate what kind of humanitarian needs are coming down the pipeline, and then position ourselves to respond to those.
Those are really exciting initiatives, and I'd be happy to maybe not on this panel if we have time we will to explore some of those initiatives with you, Joe. I'm going to turn over to Gary because you, Gary, and your team at Healthcare Without Harm have been really doing this for decades, building partnerships, coalitions to transform the health sector and make it more environmental friendly and environmentally sustainable. Can you talk about new partnerships that you're engaging with now and how that's helping scale this work up? And are there partnerships or sectors that you really want to engage in but haven't had success yet?
Yeah, great. Thanks, Jenny. I just want to add something first, which is what's the imperative for the health sector to deal with its own climate footprint? We did an analysis, global analysis, and said that the health sector was almost 5% of global greenhouse gas emissions. So that's the equivalent of the annual emissions of over 500 coal-fired power plants. So that's a huge impact. And if healthcare was a country, all of healthcare, it would be the fifth largest climate polluter around the world. And given that healthcare is the one sector of our economy that lives by an ethical framework, the Hippocratic Oath, to first do no harm, it has more responsibility than any other sector and a mission imperative to address its own climate footprint. If we're going to build an economy, which we must do, where health and equity are part of its DNA, this is the mandate that Joy was talking about. Healthcare can lead that effort. Healthcare can demonstrate how do we build resilience into our supply chains, into our global healthcare access. How do we make our commitment to having everybody on the planet have healthcare as a basic human right, especially in a climate-stressed world, which is incredibly inequitable. So that's also part of the framing here. And given that healthcare is 20% of the US economy and 10% globally, it has this outsized impact to model that transformation, to move away from fossil fuels, to move away from toxic chemicals, to move away from pesticide-intensive industrial agriculture. So part of the partnerships that are helping us in that are a few really important ones. One is that we were part of that effort with the World Health Organization and the British government around those 50 plus country commitments to decarbonize their health systems and to make them more resilient. So the opportunity to implement that now, to show national governments how they can move their health systems to decarbonize, to make them more resilient in many of the ways that Joe is talking about. How do we solarize thousands of clinics all over the world? How do we have solar-powered autoclaves to deal with medical waste? How do we have solar-powered refrigeration to keep vaccines, essential vaccines, refrigerated? So one of the partnerships is this with the British government and WHO to implement this COP26 health program and spread that across 50 countries. 75% of all of the climate footprint in healthcare is in the supply chain. It's in the stuff we buy. It's in the reusables or disposable. It's in the toxic plastics. It's in the machines. And so we've partnered with the United Nations Development Program on a program that is designing globally validated standards for products and technologies, and to spread that across all these countries and systems so that we can drive the innovation in the supply chain to move the whole economy that's based, that where healthcare is based, toward a low carbon, toward an equitable, toward a climate smart strategy.
These are really huge, really important partnerships. Just very, very quick question, follow up on that, Gary. Are there sectors that you would want to partner with but haven't had success yet?
Well, I think that there's a few. One is that we need a lot more clinical engagement. We've been focusing a lot with hospitals and operations and energy and procurement, all that. We need, like MSF, we need lots of organizations like the Clinton Health Access Initiative. We need clinical champions, messengers to be innovating and understanding and teaching people about how climate at the end of the day is a health issue for everybody on the planet, and that we need to change models of healthcare delivery in this new reality. So many more physician, nursing, public health organizations all around the world making this a strategic priority. The second is a whole set of product and technology innovators so that they can bring forward the next generation of medical devices, of moving away from petrochemical plastics, the next generation of reusable equipment and reusable gowns, the next generation of energy smart technologies. We need all of that to scale up around the world over the next 10 years. And I think the third one I would mention is philanthropy, because there's been this divide between philanthropy that funds environmental issues and philanthropy that funds health issues. And they haven't seen that environmental health is fundamentally linked. You can't have healthy people on a sick planet. So if we're gonna solve this, we have to multi-solve this, so that as we are decarbonizing healthcare, we're improving the health of everybody on the planet. We're driving innovation. We're creating access for everybody on the planet. We need to see these things as absolutely interconnected.
Thank you so much for that, Gary. I want to go back to Joy and now ask, because Gary and Joe have spoken about solutions, and I also wanted to ask you, can you maybe point us to maybe one example of a practical solution that you've come across with or took part of, and how much tech and innovation and partnerships feature into that solution?
Thank you so much. I mean, I agree with the comments that have just been made, that there is a lot that we can do. I'll just give an example of one area that is, energy in health, clean energy in health. We know that currently electricity generation is powered by, sources such as wood, coal, diesel fuels. And when I talk about health, because, wood and coal and diesel fuels are carcinogens, and they also, of course, contribute to respiratory tract infections. I will also talk about health sector, health in the home, not just in the facilities. So I feel that there is a huge opportunity for a very, very synergistic partnership, a strong partnership right along the value chain, from the time when the equipment and that is being used in the home and in facilities is being manufactured to make it eco friendly, whether it is the fridges which are being manufactured or indeed stoves for poor households to use in the home, because there have been so many innovations of solar powered coal stoves that are powered by biogas, and that need to be adapted on a whole scale. So the first partner has to be with those people who control the supply chain, just from where the input starts, where the solar panels are being manufactured. Those manufacturers, those suppliers of solar panels must be the first partner that we look at. And then we must look at the next partners in the value chain, the ones that are the middlemen between the manufacturer and the supplier at household level and at country level. But what I'm trying to say here is that there is a huge opportunity here for the health sector to partner with the energy sector, to partner with the manufacturing sector, to partner with the finance sector, to ensure that we have an integrated strategy in every single country that is going to dramatically reduce the use of fossil fuels in the economy, and particularly in the health sector. So I feel that it is time that the health sector appreciated that on its own, it cannot intervene effectively, but we need these partnerships with other sector, between the public and the private sector. some of us in the health sector need to consider how we can partner with governments. First of all, let us develop the policies and strategies, multi-sectoral in nature. Let us make sure that we strengthen the Ministry of Health's service contract management capabilities and monitoring capabilities using, technologies, that will enable us to do this. Design and implement financing solutions that will enable sustainable solutions for clean energy for households and communities, and generate evidence. We need to generate this evidence so that we can shade and we're able to replicate the success stories. One of the mistakes that we are currently making is that there are lots of golden nuggets, all over the place, but we're not pulling them together. We are not all using them. We need to adapt all of these, adopt them, and take them to scale so that we can actually have a health sector that has got clean energy and that is servicing communities with households that have clean energy. So I just wanted to emphasize that particular one point and the need for partnerships in getting us there.
Thank you so much for emphasizing partnerships. And you've mentioned several things there, but something that caught my attention was, talked about integrated strategies and supply chain. I want to go quickly to Gary just for a minute because, weight, COVID waste is currently a big issue, and WHO has released a report on it recently. I wanted to ask Gary, could we have avoided this problem? How do you think this can be avoided in the future?
Well, one thing that we've learned is that in many cases we've been using disposables, disposable gowns, disposable footwear, disposable, so many different disposables to address immunization. And there's a number of examples from the Philippines, from the United States, from elsewhere, that if we can move toward reusables for much of that personal protective equipment, then we can save an enormous amount of energy. It's just as effective, and we can save a lot of money at the same time. So we need to rethink this whole idea of disposables. And also that we saw with COVID that the global supply chains were fundamentally disrupted. So moving, as Joy said, to integrated solutions where we're producing much of what we need in the countries and the communities that we need them will have a huge positive economic multiplier impact on top of also addressing the climate issue and providing healthcare to everybody on the planet. So there's a lot of ways that we can innovate and also move away from some of these disposables, move away from some of these petrochemical plastics, which is moving to replace coal as one of the leading factors in improving in contributing to greenhouse gas emissions. We need to move away from these plastics. So I'll stop there.
Mm-hmm. Well, I wanted to quickly ask for our audience organizations working to try to be more climate smart. I want to get insights from Joe about what are maybe one or two biggest challenges MSF is facing as you're making this transition, and how are you overcoming those challenges?
Yeah, thanks, Jenny. That's a huge question. And as a global federated organization, more than 60,000 employees working in more than 70 countries, there are just so many kind of challenges. So I'll just quickly highlight three that I think are kind of maybe hit the nail most closely. So the first is the measuring part. So we took this leap of faith. We collectively agreed to this 50% reduction target. We don't fully know how we're going to get there, partly because we don't currently measure our environmental footprint in any systematic or global way. So simply that, setting baselines across the organization, using the same metrics so that we can centralize it and then actually have a visibility on the global footprint. Gary was talking about the waste. Okay, so how do we sort of measure our waste output, and then on the basis of what you measure, you mitigate. So we have now a toolkit that we developed actually over the last 4 years, which is precisely designed to help us categorize, systematize, and measure. on the faith again that once we start to do that, then we can have this much clearer idea of the actions that we're taking, solarizing, the waste management actions, flights that we're using, all these things. What is the actual impact on that, on our 50% target? That's the first big challenge, just the measuring. Second big challenge is mindset, frankly. You've got so many people in the MSF movement, just so passionate, so dedicated to the humanitarian work that we're doing, and it's an emergency mindset. We're constantly active in doing, and the priority, I'm going to actually read you this quote. It's from one of our directors of operation. As an emergency organization, it's a daunting task to green our operations because our priority is still to provide rapid assistance in some of the world's most remote places. Now, we know that rapid response and greening, becoming climate smart, are not mutually exclusive, but there's a lot of mindset shift work to do. So in fact, a lot of what we've been doing the last couple of years is internal advocacy, just raising awareness, raising climate literacy so that we can have these conversations and change how we think about our how we work. And the last one speaks a little bit to the partnerships and localization. Our role in resilience, because as an emergency response organization, we've tended to downplay resilience. Development-oriented organizations play a stronger role in working with communities to build resistance. That said, take Somalia, for example. In a context like Somalia, we know year after year this cycle of drought, floods, food insecurity. It's not something that you just go and respond to once and then step away. It's so cyclical and so recurring that and other contexts like it is causing us to question our role in resilience. So in Somalia, for example, we are now working more closely with local communities and community leaders to identify where the vulnerabilities are, what the patterns are, what communities themselves can do to prepare for those, and then where MSF comes in that more kind of emergency mode when the needs become more acute. So those partnerships with local communities is becoming a more important part of how we're thinking about the climate crisis.
Thank you so much, Joe, for that. I think we only have 1 minute, but I want to make sure we invite our audience. And we've received a question from the International Federation of Medical Students Associations. Let's hear it.
Hi, everyone. My name is Blom, and I'm the liaison officer to the World Health Organization at the International Federation of Medical Students Associations. We are an NGO in official relations with the WHO with over 1.3 million members worldwide in 130 countries. I'm a medical doctor from the Netherlands and currently a PhD candidate at the London School of Hygiene and Tropical Medicine, researching environmentally sustainable healthcare systems with resilience to climate change under the supervision of Sarah Whitney and Andy Haynes. Thank you for the opportunity to ask a question. As the IFMSA, we work on a wide variety of global health issues, including the health emergency that is climate change. Young people are severely impacted by climate change. Also, they have a unique perspective. As one of the biggest demographics of this planet, having grown up in a digitalizing and globalizing world, we see unique, innovative, and creative solutions, not only for tomorrow, but also for today. How do we ensure that the voice of youth is part of the decision-making, including policy design, implementation, and evaluation on every level? Thank you very much.
We don't have much time, but if each of you can just very quickly address that question, please. Maybe I'll start with Gary.
Yeah, I appreciate the question. We see young nurses and doctors really coming to start to build a movement in healthcare all around the world. And it's crucial because doctors and nurses and other health professionals are the most trusted members of our society. And they can be crucial for both innovating healthcare delivery models, but also being messengers and advocates for policy that are going to get us out of this global crisis.
Thank you. Anyone who wants to jump in?
Yeah, no, I just wanted to say that what I'm finding now that is really energizing, and for some of us who come from a continent which has got a huge youth population, and are really looking forward to benefiting from a demographic dividend, is that a lot of the innovations that are happening now, the new technologies, even when it comes to climate change, low carbon based solutions, they are coming from young people. So I mean, this is a very, very powerful message that the future really has to be designed by the young people, and we have to put young people in the driver's seat, and they have to be part of the policy discourse. They have to be part of the implementation and the solution and the monitoring of impact. So I absolutely agree that young people are in the driver's seat. We just need to move out of the way, because they know where to drive this vehicle, and this vehicle is we are driving it off the cliff, and we have got young people here who know where to take it. So I couldn't agree more, and we need to work more with them and appreciate that this planet is theirs to protect.
Well, thank you so much, everyone, for this really very insightful conversation. And for those of you who tuned in, you'll see the live illustration at the end of this panel. And please stay tuned, because we have a lot more really engaging conversations happening next.